Welcome friends to our session of FP Live presented to you from Narayana Superspeciality Hospital's Howrah. We are here today in the presence of two very eminent oncologists. To my immediate left, we have Dr. Suman Mallik. Sir is a radiation oncologist, a senior radiation oncologist and the clinical director of our institute. To the further left, we have Dr. Sourav Datta.
Hi.
He is an eminent head and neck oncosurgeon of the city, and both of them together and me, Dr. Harsh, we are here to talk about the importance of tobacco awareness on this special day, 31st May, which is the No Tobacco Day celebrated by the World Health Organization. So I'll start with Suman sir. Sir, tobacco is, we all know that tobacco is bad. Could you just elaborate on how it affects the health, and especially in terms of oncology, what kind of all the cancers it can lead to?
So tobacco, not only cancer, but tobacco is one of the leading cause of death in all over the world, and almost we are losing around 60 lakhs people each year due to tobacco, and it causes not only cancer but also some important lung disease like COPD, asthma, other respiratory illness, and it also causes cancer to other parts of our body apart from lung and head and neck region. So that's why it's one of the most important preventable cause of death of the world.
Right. Sourav, we've had a recent study about the GATS, the Global Anti-Tobacco Survey. Could you just tell the viewers about the prevalence of tobacco usage and how it has reduced in India over the last 7 years?
In India, majority of the tobacco users, about 60%, they chew.
Right.
And so majority are tobacco chewer, and they are a smoker as well. So there is a significant decrease in last few years in tobacco consumption in our country, or rather tobacco addiction. So from 2010, a huge campaign was started in all over India, led by Tata Memorial Hospital. My teacher, Dr. Pankaj Chaturvedi, was the key person for that. And after this, we could see a huge effect. There was 6% drop.
Yeah.
So about there was 35% people were addicted to tobacco in 2010, but according to this latest 2016 data, that has reduced to 29%. So around 28.6, it was 34.6, and now it is 28.6. So there is 6% decrease in any epidemiological study. It is huge. But having said that, and there was a lot of steps has been taken, like gutka ban. It was a huge step, and a lot of other steps. But having said that, there is no point to be happy about that. We should be very sad that knowing that tobacco is a killer, it kills so many people, still about 29% of our adult population are addicted to tobacco. So the next global adult tobacco survey will be in 2022, and we all are working to a target that by that time we should reduce it to 20 to 22%.
That would be very great if we can actually achieve that. And on the same line, sort of that, would you just elaborate a little bit upon e-cigarette? Because with tobacco cessation, many people thought that using e-cigarettes can actually help in avoiding the harmful effects of tobacco. So where do we stand on that today?
Look, e-cigarette is nothing but it is a marketing strategy by tobacco group.
Right.
Now when they realized that all over world people are getting conscious, there are a lot of people who are going all out to war against this tobacco, they thought that they have to shift to something else. So they produced this e-cigarette and they tried to promote it, that it is less harmful. I am quoting this. This is less harmful. It is harmful. So, but this is less harmful. So it's like it's jumping from 12th floor and jumping from 8th floor. So both will kill you, but you can be happy that I am jumping from 4th floor less.
Right.
It's like that. But I am really happy with the government of India decision that they have banned this e-cigarette, and so now there is means we should be all aware that government has realized that it is extremely harmful as well, and they have banned it.
Right. Okay, Dr. Suman, my next question to you is upon the importance of stopping tobacco for any patient with cancer and how it benefits his treatment.
Yeah. So we don't get immediate effect after stopping tobacco. It takes time. So if you ask me about the reduction of the incidence of cancer or chance of getting cancer, probably it takes a longer time, maybe more than 5 years. But definitely in the patient who is on cancer treatment, for them it is important to stop tobacco, because tobacco can interact with several anti-cancer management like radiotherapy and systemic therapy, and there is a higher chance of recurrence that we have seen those who actually continue tobacco.
Right.
So, and as well as during cancer related therapy, there is a chance of systemic other problem like chest infection or respiratory problem if they continue on smoking or chewing tobacco.
Right. And could you add a word about screening procedures? Do you feel that screening for cancers amongst tobacco users, is that helpful? Do we have any evidence to support that in
Yes,
a setup like ours or in a country like
in
ours?
our country it is difficult because we have a huge population, and if you consider about 29% of our population using tobacco, screening in 29% of our population is next to impossible. So more than screening, it is always important for cessation of tobacco. But definitely those who are heavily dependent on tobacco, if there is feasible, we can consider in few patients or in few group of population.
So probably opportunistic screening is viable for us to follow, that whoever patient is coming to your clinic now, whether you are an oncologist, whether you are a cardiologist, it's always good to screen these patients for the presence of any cancerous lesions or pre-malignant lesions. Having said that, Dr. Sourav, today we are seeing an unprecedented pandemic around the world of the coronavirus, the COVID-19 pandemic. Is there any linkage between increased tobacco use and acquiring this virus? Do you think that there might be a plausible relation?
Look, it is difficult to say.
Absolutely.
Because we cannot just predict without having sufficient data.
Right.
You can see one study even quoted that it decreases, it is nicotine may be protective, but there is a lot of loopholes for this study. But if you think about the pathophysiology, then probably a smoker's lung will be more affected by COVID. But I am saying this is a pathophysiology from a clinician's perspective.
Correct.
So, but I cannot tell confidently with data that actually it is harmful, extra harmful for the smoker. Secondly, now we are not talking about only smoker. So in our country, majority tobacco users are chewers. And if you see, these all people, they spit every time they chew. So this spitting will definitely increase the coronavirus spread in the country.
Yeah.
So the government of India has already started a campaign that stops spitting.
Right.
And as a clinician, as an oncologist, we should use this one, and we have already started another campaign that this stop permanently spitting. So this spitting, this does not means it is not limited to only coronavirus.
Right.
These people means you can see people are spitting everywhere possible. and this spitting carries a lot of infection. So from this spitting, you are not a smoker, you are not a chewer, but you can get some viral infection because somebody next to you are spitting from the bus.
Absolutely.
So this thing we have to stop.
Right. Along the same lines, as we are talking about tobacco and talking about cancer, Sumanda, could you tell us a little bit about how cancer treatment has been affected, and basically as a hospital, what measures we are taken during this pandemic so as to protect ourselves as well as ensuring treatment is continuing for our cancer patients?
Yes. Actually, we are going through a very difficult situation now, and it's difficult for both for a doctor or a patient, because we are trying to save ourselves and our staffs from COVID, and as well as we want patients should not get infected when they are admitted in the hospital. So that's why we are we are following very stringent precautions now. Whenever we are getting a patient for an elective procedure, semi-emergency procedure like for oncosurgery or radiotherapy, so we are screening them for COVID, and we are following them for any kind of sign or symptoms of like COVID, because we know there are a lot of patients who receive chemotherapy, they may have fever, they may have cough,
Right.
or chest infection. So it's not that we should not see those patients, we are seeing those patients, but we have to be careful, and we are following universal precaution for dealing each patient, because now actually we are going to a situation where there are many asymptomatic patients or asymptomatic individuals, even asymptomatic healthcare workers.
Right.
So we have to safeguard ourselves from the others. So that's why we are following universal precaution like wearing PPE whenever we are in the hospital, wearing N95 mask in every procedures. So that is important. So instead of restricting the patient, instead of keeping them in the queue, or instead of reduction of the number of procedures like surgeries, so it is important to protect each of us individually with proper universal protection.
Right. So friends, we've heard about tobacco, we've heard about the importance of tobacco addiction's relation to cancer. We've also heard about the importance of screening, opportunistic screening in our society, and the fact that with the ongoing pandemic, tobacco usage can increase the incidence of spread, likely, though we don't have numbers or scientific studies, but there is a definite reason to believe so. And at the same time, while the pandemic is on, we are taking care, we are taking measures to continue treatment, protecting ourselves and protecting our patients as well. So I think with that, we'll wrap up this session with the message that, dear friends, stay safe, stay away from corona, stay away from tobacco.